Okay. Let me listen to your heart.
You know, medicine is really considered both a science and an art. And in the last 100 years, the science has developed to a significant degree. And the tools that are available to us now probably number in the hundreds of thousands. Anything from robots to help with surgery to imaging studies where we're not only looking at the structures of the body, but even the function of the body internally. We've got all those tools available to us. On a daily basis, I use things like my stethoscope. I use my pen a lot. I do a lot of note writing and that type of thing. But the other side of medicine that I think we're seeing a rebound for is really the art of medicine. And the tools that I use all the time are tools that I have within me. And it's my ears, really listening to my patients. I was taught at the beginning of my medical career that if you listen to your patient, they'll often tell you what's wrong with them. And I've really found that to be the case. I use my eyes, my powers of observation a lot. I can look at things like the color of the skin, color of the eyes, postures, different things like that to tell me what's going on with the patient. I use my hands a lot for two things. One, we're taught to use our hands for examination, but also use our hands just to connect with a patient. I think it's really important that patients feel like they're not alone, and a lot of times just something as simple as the human touch can alleviate stress for somebody. Use the power of my voice, my mouth to educate my patients. And again, that's another part of the art of medicine that I think we're losing. And sometimes just spending a little bit of time with someone to communicate with them makes all the difference in the world. The number of journals available to us as physicians probably number in the thousands. And it gets a little difficult to sort through some of the information. So one of the things that I do is I use the internet a lot. Now the problem with the internet is that there's so much information out there, it's sometimes hard to sort through what's appropriate information and what's not. And there are a couple of websites. I use www.pubmed.gov, which is an excellent source for me as a physician to find out what the latest articles are that are available. I'll sometimes go to the National Institutes of Health websites. I find those are very solid. And then in particular journals, certainly things like the New England Journal of Medicine, the Journal of the American Medical Association. In my particular experience as a physical medicine and rehabilitation specialist, I use the Archives of Physical Medicine and Rehabilitation. But again, I think it's important to really have access to all of the journals and all of the knowledge. And I've found that the internet is just an excellent source for that.